Welcome everyone to this video. My name is Raymond Ian and I'm going to get through our latest product called Smart Clinic 360, which is a hospital management system. And this covers all aspects and all workflows of the facility, starting from the receptionist to the doctor, to the lab, to the radiology, and finally to the to the pharmacy or dispensary. So without wasting any time, let us start. We are going to we're going to look through all the different departments. This particular platform supports unlimited number of roles. However, the crucial ones are 8, and that is the admin, that is the reception, that is the doctor, that is the nurse, lab, radio, pharmacy, and finance. So, to kick off, we are going to log into the admin department. We are going to go department by department, and we see how each department relates with each other. So, I'm going to log in here. When you log in as the admin, you get this dashboard. It is the page that you land on. We have the total patients, total staff, total wards, total rooms, total beds, and total upcoming appointments. Then we have the name of the person who was signed in, and you have a side nav bar that has the roles of that particular permission. So as the admin, you are in charge of departments. Under staff management, you are in charge of departments, personnel, services, and inpatient charges. So, under departments, we have the lab, reception, radio, doctor, and all these other departments are not editable and you can't delete them. Why? Because these are the backbone of the platform. However, you can add a custom department. You can add as many custom departments as you want. And all custom departments, you can edit them, are editable. You can also delete the department. Yes. So we're going to create a sample department. And in each department, there is a staff count. Staff count is the number of personnel that fall under that department. So we're going to come here and manage users, and we're going to create a new personnel. The email is important because that is why the system automatically sends the personnel their one-time password once their account is created and they have system access. The system sends that particular personnel a one-time password which they use to log in for the first time, and then they can modify their password to suit to whatever they want to use as their password. So I'm going to assign this one to we can assign them to the sample department, but I want it to make sense. I'm going to assign them to the radio department. I'm going to give them a salary of 340,000, and then I'm going to assign them to that. Yes. So once you add a staff member, you can edit the staff member and you can delete the staff member. So you can also filter. We have the filter here. You can filter by the department. If you want to see which staff members are in what department, you can filter through using that. So to proceed, we are now going to check what is in managed services. So services, these are offered by each independent department. Each department offers a different number of services. Yeah. For example, we have a long list of services here, but we're going to filter through. With the lab department, we have the lab tests. Blood film, CBC, ESR, blood grouping, HIV, uric acid, urinalysis, so on and so forth. All these are already scaffolded for you. You don't have to input them. All you have to change is the price. And you don't have to change the price at once. You can change the price on the go. So you can also filter. We don't have the reception, it has no service. However, in the radiology, we have the CT scan, X-rays. All this is already scaffolded for you. Then in the doctor department, we also have their own roles. their own services. My bad. So uh, we're going to create a new service, and we're going to give it to the doctor department. So I'm going to say maybe mental health, and I'm going to give it a price of okay. Now we have our new service created. We can edit it, and you can also delete it. However, we need it, so I'm going to add it back. Doctor, and I'm going to add mental health and a price, which is this just random numbers. So with the services done, we now have to manage inpatient charges. So what are these charges? These are charges that are automatically placed or part of the inpatient bill when a person is admitted. These are charges. They normally include bed space. They normally include maybe food, if any, depending on how the facility builds. You can have a VIP. You can have a VIP charge. Let me say VIP, and then maybe we can 50,000. And the frequency, is it charged daily or is it charged once? So the VIP, we say it is charged daily, and you can add a test description here and we save. So once we have that charge, we are going to see how it comes into play later on when we start admitting patients. So we are going now to, after we have seen what the charges are, we're going to visit the facility management. Facility management, this counts for wards, rooms, and beds for the patients. So we can add a ward, we can add an emergency ward. And in each ward we have rooms. So in the emergency ward, we need to add maybe accident and a room for accident patients. Let me add another room. Then after accident patients, we can have maybe let me just call it an ICU. Okay, so you have two rooms. As you can see, we have two rooms, and we have two rooms under the emergency ward. Now in each ward there are beds. So we're going to come to our emergency. We want to select a room, the accident room, and we add a bed number. ICU, we add bed number. So as you can see, we now have our ward. In our ward we have two rooms. Each room has one bed. So that is basically facility management. And after that we have system settings. Here, this is where you manage system subscription. And well, after joining us, we give you 30 days of pilot, 30 days of trial of gold access. If you want to renew, this is where everything is done. Yes. Here next to the username, we have the settings. This is where a person can change their email, and they can also change their password. All right. Now we are going to start the patient workflow. Yeah, I'm going to log in as the receptionist. I'm going to log in as the receptionist so that I show you what the receptionist does. Yes. All right. So we are now logged in as the receptionist. This is the receptionist dashboard, and we have the sidebar. We have the dashboard, patient management, and appointment management. On our dashboard, we have the total number of patients, total new patients, total visits today, how many people have visited us, that is the metric. Online personnel, this is how many people are actually currently logged in into the system, and today's appointments. The receptionist doesn't actually have much to do. However, under patient management, we have the patient rota, which they're in charge of. Here, we register all our patients. So when a new patient comes in, we're going to use maybe some deeds. but let me edit this here. Yes, mail. The email is very important because it is what the platform uses for communication between the facility and the patient. The system is automatically set to send a medical report to the patient every after 6 months in case they have any visits between that period. So I'm going to add their contact. We have their home address. We have the next of kin. The next of kin is important because there are situations whereby we have patients that are underage. Sometimes these patients don't have their own email addresses. A patient can be maybe 5 years old. So the next of kin can be the father, can be the brother, can be the sister. In this situation whereby the patient is young, the next of kin email is used to receive the reports and the results of the patient. So I'm going to put in our next of kin here. These are just sample emails. Then the payment method, what they're going to use on this particular visit. Then I save. So once we have our new patient in the system, there are scenarios. Yeah, there are scenarios. The patient can come in when they want a specific service. Maybe they want an HIV test, or a patient can come and they actually don't know what is paining them or what they're suffering from. So they have to first see the doctor for consultation and analysis. But we're going to get there in a few. So before we start on the workflow, we are going to check out the appointments. Here, under appointments, we have upcoming appointments and appointment history. Upcoming appointments, these are appointments that are in the future. We have the date, the patient name, contact, department, personnel who they are going to see, date, and the time of the appointment. Yes. We can also schedule an appointment here. Plus the time. We schedule appointment here. So once an appointment is scheduled, we get the patient email and they receive an email telling them that they have an appointment that has been scheduled for them on this particular date at this time at this particular facility. Yes. You can as well modify an appointment. You can delete an appointment. Then we have the appointment history. Appointment history are all past appointments. The system automatically flags missed appointments as cancelled the moment the date passes. The appointments that were supposed to happen on that particular date are marked as cancelled. Yes. Now we are going to move on to something else, which is the most important, and that is the workflow. What happens after the patient has come? We already have their details. What happens? What is going to be done? So here, case scenario number 1. Today, some leads has come in and they want maybe to perform an HIV test, meaning they're not actually sick, or maybe they just want a result. They want a particular service, a very specific service. What do we do? What we do here is the receptionist comes here and clicks on create visit. Once they click on create visit, we can select it as a general visit. It's the type of visit it is. Yeah, and the condition of this patient is not an emergency, just an ordinary patient. We can put in any notes, if any. Then we can assign a service. So this particular one, somebody wants to do an HIV test and also wants to do urinalysis. Okay, no patient comes in wanting to do urinalysis. That we're going to see where that applies. So in this situation, somebody wants to do an HIV test. So we select lab, we look for our HIV test. It's right here. Then there's no discount, then we save. So what happens when this is saved? This is automatically set to the lab department. The lab department will receive a notification that, well, you have a pending request that needs to be addressed. So I'm going to sign out, and then I sign in as the lab attendant to show you this. So I'm going to sign in as the lab attendant, and yes. So this is the screen of the lab department, and they only have two functionalities: they have the test requests and inventory management. We're going to visit both. So to make it simple, we have a whole list of pending lab requests, demo data, and what we're interested in is some leads, which is the HIV request that we have, which is the HIV test request that we have just input. However, in the lab department, we can't fulfill this request because the service is not paid for yet. So after, meaning the patient now has to go to the finance department. They make the payment so that their request is marked as paid. So I'm going to log in as the finance personnel, and here we have the password. All right, we are going to also visit this. What we are interested in is here, unpaid services. When I come here, we have all these unpaid services, and our highlight is some leads. They have a pending HIV test. So we're going to confirm payment. The cost is 1, so we're going to receive 1 cash as a payment method. However, you can add as many payment methods as you want. That is catered for here. Payment methods. You can add another payment method. However, we are going to some leads. We're going to confirm a payment, which is 1, and select cash. Status is paid, so I submit payment. Once that is marked as paid, it disappears from our list, and when we log back into our lab department, we have some leads down here, and their status is now paid. Their payment status is now paid. So we have 2 options open here. The one is we can upload test results. How this works, there are situations whereby maybe the results are automatically generated by a computer, maybe like a CBC. So I'm going to upload something here, maybe this document. Yeah, I'm going to upload these files. Then I'm going to add any notes, if any. You can also leave it blank, and I save. Yeah, that is one way of doing it in case the person wants a CBC. However, I'm going back to the reception now, and I need to recreate this visit again so that we use result templates for this particular patient of ours. So now I'm going to log in again. Alright, so I'm going to log in again, and we're going to visit our patient rota. Some leads, we're going to create again another request. General, ordinary, going to do lab, HIV, save. We are now going to log out and receive payment for it. Yes, unpaid services, some leads HIV. We're going to confirm our payment here. Payment method is cash, and we submit. Once that is recorded successfully, we sign out. Now in the lab department, we are going to the lab department. We're going to Right. So our HIV test now today we have seen how upload test results works. We are going to see how use result templates works. So in our platform we have already scaffolded a good number of test templates. So the lab technician all has to do is click here and select a template, whatever suits them. So we have the HIV test template which we're going to use, RCT, VCT, HCT. These are common terms and the medical personnel do understand them. We have the malaria test, MRDT, BS. We have the blood sugar analysis. We have the brucella analysis. We have the film comment. We have the generic lab test. This just in case that we don't have a template for the test you're performing, you can use the generic lab test. We have the HCG test template, and we have the urinalysis test template. The urinalysis test template, and hepatitis B, H. pylori, stool analysis, typhoid, syphilis, and blood group. So, but however, in this particular situation, we're performing the HIV test. So, how does it work? In most cases, the most used method to test HIV is the RCT. So, some leads, the first test we do is the determine test. So the lab technician, all they have to do is click this and select. If it is non-reactive, means some leads is negative. However, if it is reactive, then they have to proceed to the starter pack. If the starter pack is non-reactive, then they go to the ST bio line, so on and so forth. However, in this situation, we're going to select non-reactive, meaning some leads is negative. We save these results. How do we preview these results? Now we come to test history here, and some leads right here. The first test whereby we uploaded the file, the lab technician, if you want to preview what they uploaded, just click on this and it will be displayed here. However, what we're interested in is right here. So in this situation, we used a template, and when you click this is what we view. This is generic information. It is customizable to what your facility wants: the logo, the name, location, so on and so forth. And this is how the result template looks like. So this is what you print out. Some leads, patient, name of the test, HIV. Some leads, then the test type that was carried out, VCT, then the results. Then once printed, the official signs and stamps. You can click this and then you trigger the printing once you have the printer connected. That is basically it as far as the lab test results, as far as lab tests are concerned. Then the next bit we have here is the inventory management. Here we have sundries. These are what are used in the lab, so we're going to use maybe test tubes. We have 100, we want another 20. Do they come in boxes? Yes or no? I'm going to leave it at that. Then we're going to restock. We can restock. Right now we have 100 test tubes, so we're going to restock. Add item or test tubes, we're going to add more 100 pieces. So when I save that, our restock records are updated, and when you come back here, you see our quantity in stock has increased by 100. We come back here. We have an action of reversing in case a person has made a mistake. However, this action is only available before the record makes 24 hours. Once it's past 24 hours, the action disappears, as you can see down here. So when the person is going to use, when the lab technician is going to use any sundry, come here and record usage. I'm going to remove maybe 20 test tubes. I'm going to use them. So sundry usage recorded successfully. When we come back to our sundries, we have reduced by 20. We went with 180 in stock. That is basically the lab department. And now we are going into they're going to create a scenario whereby now the patient has come in and they're actually going to do consultation first. They don't know what they're suffering from. So I'm going to sign out, then I log in as our receptionist again to create another visit. Alright, so patient rota, some leads. I'm going to create an maybe okay, it's a general visit, ordinary. Over this, they want to see the doctor. So doctor consultation, save. So with that created, they need to go. Some leads has to go to the finance department and pay for consultation first. Okay, unpaid services. Some leads consultation. We're going to confirm payment of 20,000 cash and submit our payment. So with that done, we are now going to log into the doctor dashboard. The doctor dashboard. All right. So in the doctor dashboard, we have the total patients, total inpatients, total outpatients, patients in queue, today's appointments. Then in the sidebar, we have the dashboard, patient queue, and under it, you have patients in queue that are waiting to see the doctor. You can see we have some leads here. He's waiting to see the doctor. We have the patient admission. These are all admitted patients. And we have history and operation, assign tasks. Here, the doctor can assign tasks to nurses. In the absence, maybe administer medicine to an admitted patient at this time. We have the task history. We have the view lab results. We have already seen this in the lab department. We have view radio results and admission history. And admission history, you can see the admission record, the medical record of that particular patient. We have the patient information, full name, the admission details, date of admission, when they were discharged, the location, they were in which ward, they were in the children ward, they were in the general room, on bed number 1, who admitted them. And now these are the inpatient charges, the packs. However, we're going to see how we can apply them. Then medical history, you can select a patient. I'm going to select this one, I generate a report. Medical history, I can see the patient, all the allergies, all the visit history, all the visits that they have had, what medicine did we prescribe, what services did they get, everything here. Then we have the admission history. Have they ever ever been admitted? Admission date. Then if there was any ward transfer, where we have the records of all their vitals as that admission was going on and the medications administered during that admission. So we're going to come back here and we're going to go to patients in queue and we're going to meet our some leads. Some leads is going to be acknowledged now since they're finished paying for their consultation. And when they're acknowledged, the doctor is going to take in their vitals. These are just sample digits, so don't take them serious. Right, mobility, they're independent. Triage, they are we have a triage guide here. So yes, we have green, yellow, orange, red, minor. Green is minor, yellow is urgent, orange is critical, and red is emergency. They also have the description here. So yes, that is how we record the vitals of the patient. Then after the doctor gives their assessment, self-assessment. Since it's a new patient, we can also ask them if they have any allergies. Do you have a food allergy? Allergy to flour, they get a rash, save allergies. Then we have presenting complaint, what they're complaining about. So here we select a list of signs. We have a long list of all signs. This is what the doctor sees, and you can select. We have a wound. You can select as many as you want. Then we also have symptoms, what the patient feels, anxiety, is it abdominal fullness, as many as you want. Then we can add any additional complaints. Then we save our presenting complaints. Then we have history and examination. This is optional. Diagnosis. Here we have a list of the commonest diseases. We have a list of the commonest diseases here. However, we need to first understand what the problem is. So after the doctor listening to what leads us to say, you can now request for an investigating procedure. So we come here and we want, according to the symptoms that leads us talked about, we want to perform a malaria test, blood slide. We want to perform one. We also want to perform another test. We want to perform let me just add a generic one. Maybe we also want to perform a blood grouping. So we save. Now these requests are automatically sent to the lab. However, for them to be performed leads us to go back to the finance department, clear the bill, then they are automatically updated in the lab section, then they can work on him. So we also have a medicine prescription, antimalarials. We have a whole list scaffolded for you, depending on the department, depending on the category you select. Yes. So we're going to, let me add generic figures here. Maybe 1 week, food relation before food, root oral, then specific instructions if any. Then we add prescription, anti-ulcer, Penagra, oh my bad, contradiction, yes, I want to add, let me add anti-malaria. Alright, so we add, this is how the doctor prescribes medicine. Then after we submit prescription, this prescription goes direct to now the dispensary or pharmacy, in case you have a pharmacy on site. So in case things are bad, we can admit the patient. However, we're going to visit this later on. Let us first go and and prove that the investigating procedures indeed are reflecting. So I'm going to go to the finance first. Then under unpaid services, we have our two tests are here. So I'm going to confirm. All right. So now that some leads has finished paying, let us check our lab. All right, here they are. They're ready to be administered. All right. So we are now going to go back into the doctor department and we see what happens when. All right. Before we visit that, let us see in this situation. This is an outpatient. They're not going to be admitted. So we have analyzed, we have recorded their signs and symptoms, we have taken in their allergies. Now we have prescribed, we have sent our request now to the pharmacy. So they now have to walk to the pharmacy or dispensary. In the pharmacy, this is the pharmacy dashboard. We have the out of stock medicines running low, inpatient medication request, outpatient sales today, and we also have the monthly graph. In this month, it keeps on fluctuating depending on the amount of money the pharmacy has made in sales. So here we come to prescription management, and we have outpatient prescriptions. So we have our Samleads prescription here, prescribed by doctors who are in, and we're going to dispense. When I click on dispense, we have the medicines that doctor advised, prescribed for Samleads. So I'm going to click on the medicines that we have. Then you have the quantity that the doctor prescribed. However, this is editable depending on the stock, and it automatically calculates the bill down. So payment method is cash, and I am going to dispense. So when I dispense, I'm going to mark this as a sale. The outpatient has been referred to the pharmacy. Now we are seeing what they have prescribed for them. We're going to dispense the medicine. They pay for the medicine, then they can go home and start their medication. So when I dispense, we are getting a complaint. We have insufficient stock for Jenna acid syrup. We require 100. However, we only have available 0. So in this situation, we are going to come here and restock. We're going to restock medicine, Jenna acid syrup. We're going to restock 500 pieces. The batch number, I'm going to put a random one. This batch number is important for help, for tracking. Then I'm going to also put a random expiry date. I'm going to submit. So we can set in our stock. We have in our stock taking, we have 500 pieces of Jenna acid. So I'm going to come out here and we try again. So I'm going to dispense these medicines. Dispense request sent. Prescription has been successfully dispensed. Nice. So once the prescription is dispensed, now the patient has been given the medicine and they have left the facility to go and start on their medication. Now we are going to look at a situation whereby the patient actually has to get admitted. So we're going to log in towards the doctor. In this situation, Samleads needs to be admitted. Yes, I'm going to come here, click on admit patient. So Samleads, I'm going to select the word and the bed. Now here we're going to select our packs. Samleads wants to be a VIP. Then we have the compulsory bed charge, electricity, meals. Yeah, then we admit our patient. Now with that selected, now these packs keep on counting each individual day Samleads spends in our hospital, in the facility. Once that is done, we see now patient in queue, Samleads disappears. We can have admission history, right? So next we need to manage our admitted patient. So we're going to come here to patient admission. We select Samleads here. It's in we have the patient name, admission date, the what they are in, the room, and the bed number. We can click on this to see. What to see their medical record as far as this admission is concerned. However, we have these lab tests that are not yet done, that we have already requested, and radiology, medication. We're going to see how all this works. Then next we have here we keep track of their vitals, of Samleads vitals. So every time we can maybe say we're going to monitor his vitals once a day. We input them here. Service vitals. So this is for recording vitals consistently. As long as they're in the facility, you need to keep track of their vitals. That is what we use to record vitals. Then we've already seen this. And as you can see, our latest vitals are right here. We can view them, the ones that we have just added. Then we have the add services. Now, during their stay, this we can keep on. Maybe we're going to carry out numerous tests. So we click here on the add service. So we're going to ask for a CBC save. Once that is added, it still reflects to the responsible department. They have to go to the pharmacy, to the finance to pay, and after after the payment has been done, the lab person carries out the test. Then the test is taken back, sent back to the doctor. The doctor identifies that the test is available. Test results they can preview, and then administer medication as required. So next we're going to administer medication, and then we have discharge. But before we discharge, we're going to administer medication. Maybe in this particular time, we're going to give this admitted patient a syrup. It's going to be a syrup. We're going to give them 2, and any notes, submit medication. So in this situation, the inpatient bill keeps on piling up. Yeah, it keeps on piling up. And now that we have, if we check our admission patient medical record, we have pending lab tests. We have our vitals. Okay, we have the lab tests. We haven't asked for no radiology. All right, my bad. So, yes, we have our medication log here. If you try to discharge this patient, it won't allow. Why? Because they have a pending medical bill. So when you confirm, the patient's bill must be cleared before discharge. Please visit the finance office. So you can discharge this patient until they go to the finance office and they pay. Someone sign out, then I visit the finance office. No, my bad. So in the finance office, we have our revenue here. We have inpatient billing. So we have a list of all admitted patients and their bill status. So we can see the admission records here. All services. We have the lab test, we have the radiology, and the medication. In case they want to clear the bill, here we have the process payment. Click on it, then you open this patient bill. We have the number of days admitted. Then the packs automatically calculated. The unit price time was the days they have spent in the facility. Then we have the services rendered and all the tests that need to be paid for. Then we have the medication log. So we have, in this situation, we're going to collect our bill. Then we confirm payment. So once somebody's bill status has been cleared and we sign in as the doctor, we can now discharge them. Come back here, admission, some leads test. So in case in case the patient requires a follow up, we can schedule for it. So patient is submitted, but we're going to schedule for a follow up. He will come back and see me maybe after 2 weeks, on 30th at this time. So that is basically the doctor workflow, how the inpatients are handled, how patients who want specific services are handled, how outpatients are handled. That is the workflow. And now we are going to cover the finance department in detail. So the finance department is our dashboard. We have the total revenue, total expenses, profit, unpaid services. We have seen this. Then we have the revenue overview. This is per month, how much money we have made per month. Then we have the expense breakdown. We have the open budget analysis and recent transactions. So on the sidebar, we have financial reports. Here we have the income statement. We have the budget report, and expense report. So here under everything, here under budgets, everything has to be under every expense has to be attached to a budget. So when you are trying to record an expense, we have you need to select a budget here. So we're going to come back here. We have our transport budget. Let's say it's an expense budget, maybe for procurement. We're going to allocate this much money. It starts for this month and ends on this month and on this date. We save. Our budget has been created. So when we are spending money, we spend according to the budget. Yeah. So we come here. I'm going to add. We already have a category operations. I'm going to come to expense management. Add expense. It's a one-off. We're going to say maybe procuring syringes. Then we're going to spend maybe 500,000. This is an operation. We're going to select our budget. Then we save. So with that expense recorded, we can see when we come back here, we have our our expense breakdown. So we can see our procurement budget. It is 10 million, and we have used only 500,000. This our transport budget is 500,000, and we have used a very minimal, only 55,000. All right. So that's the importance of budgeting and expense management, how the two modules relate. Then we have the payroll management. Here we generate payrolls depending on the month. Maybe this month I'm going to generate payroll. Payrolls need to also be attached to a budget. This is just an example, but you can create an independent budget for the payrolls. Then you can select allowances and deductions for all the employees, and you save the payroll. You can see the payroll history here. You can preview who has paid what. You can export and to Excel and PDF. We have deductions. This is where you register all deductions, tax, maybe NSSF. You can also register all allowances. Yeah. We have seen expense. Then in revenue, we have seen payment methods, patient payment history. Here we have all the payments. When a patient makes a payment, it is recorded right here. In patient billing, we have seen this when we are clearing some leads bill. Let me see, for Zua Raymond. Raymond has been in our facility for 10 days. So as you can see, the quantity or number of days has been accumulating. They have a PAX bill, in charge bill of 250,000. They have been rendered these services and the medication log and the total bill. In this situation, we also the system also takes in partial payments. So the total bill was 303,000. The Raymond has only paid 198. So they have a balance of 105,000. Right. Patient billing, we have seen this when we are clearing the services for the outpatient. Some leads when we needed to do an HIV test. We saw this billing. And send payment request. All right. I think we have seen it all here. Then go back to our dashboard. That is basically the finance department, the finance functionalities. And we have seen the lab. So finally, we are going to look at the pharmacy module in detail. Then that will be it. So I'm going to log out. Then I log in as the pharmacy. pharmacy, we have actually also covered this. You have seen medicine categories. You can add your own category. You can edit and delete it. You have seen here we register all medicines, and you can also edit their prices. Here we register all medicines. All right. Medicine restock. We have seen this when you're restocking the general acid syrup. Deplete. This is when you are taking medicine out. However, in this situation, you are not selling. Now, when the patient, an inpatient, in our situation, some leads when they were admitted, and we were offering them medication, meaning the medicine was picked from the pharmacy, so, and taken and administered. However, they didn't. The pharmacy doesn't record this payment, doesn't take in this payment. So, in that situation, the pharmacist comes and counts the quantity that has been taken out, and they take in as depleted. Yeah, because it has been taken out, however, it has not been sold directly by the pharmacy. So that's the reason for medicine deplete. We have seen stock taking. We have seen where here we saw outpatient prescriptions. We saw this was B, outpatient prescriptions history, where all previous prescriptions are supposed to be. Check that out. Then we have here we have the stock report. We have the sales report. Sales report on this day, how much money has been made for the pharmacy. Now we have sales and billing. Under sales and billing, we have point of sale. Now this is an independent module on itself. In this situation, this isn't connected to whatever process is going on in the facility. The person then maybe they want a specific drug. They have nothing to do with the reception. They don't want to do any test. They just want to buy a drug. So this is how the post looks like. You can filter by the categories, and you can also search by name. So you can add. Then you can also edit the prices in case you want to set up a different price. Select payment method, cash, and complete sale. Inventory report found. Okay, so we don't have this. We don't have magnesium in our inventory. That's why this has failed. However, when I get rid of this and I try to complete the sale, checkout is successful. So we have that pause, and that is basically it from the pharmacy department. So thank you for staying with me. Thank you for staying with me throughout this entire video. If you need this service, please don't hesitate to send us an email. Our email is in the description. We shall be waiting to partner with you and provide you our platform. We are still working on many more. We're still adding many functionalities to this particular service platform. We can't wait to have you all. Bye bye.